Today is the first day of Black History Month, so we want to talk about the COVID-19 vaccine and the African American community. There may be some hesitancy to get the vaccine, and today's To Your Wellbeing, we want to address those specific concerns. So with us today is Cone Health's Chief of Health Equity and Chief Medical Officer, Dr. Alvin Powell. To start off, let's just kind of briefly share the prevalence of COVID-19 among Blacks and African Americans.
Well, thank you, Tanya, and happy Black History Month to you. And I will just tell you that for people of color in general, COVID-19 is more common, more severe, and more deadly. For African Americans specifically, according to the Centers for Disease Control and Prevention, African Americans compared to white individuals are 1.7 times more likely to have a COVID-19 infection. They are 3.7 times more likely to be hospitalized and therefore have a much more severe infection, which could require ventilator care or tracheostomy or dialysis or heart disease or heart complications associated with the infection. And African Americans are 2.8 times more likely to die from COVID-19. So it's a significant illness with significant impact in the African American community.
All right, and even though we see that kind of impact, we also see hesitancy among the African American community sometimes to get vaccines, and maybe specifically this vaccine. So let's talk about that. What would you say to members of the African American community who are hesitant about getting the vaccine?
Well, I would say we recognize that there are concerns about getting this vaccine and other vaccines. This vaccine in particular, there's a lot of newness about it. So lots of different people have concerns about taking this vaccine. But curiosity should dictate that we ask questions about the vaccine. So being curious about it and asking questions, that's okay. And that may create some hesitancy. But once we get that information, that hesitancy should go away. Now there have been millions of vaccines deployed into people's arms, and it's not so new anymore. But we also know that there are concerns about the fact that this vaccine was produced very rapidly. And there are concerns about that as well. And I will tell you that listening to scientists and reading as much as I can about this vaccine, what I do know is that no steps were skipped, nothing was missed with respect to safety. And because we had a pandemic, all hands were on deck. And instead of going from step 1 to 2 to 3 to 4, step 1 was started, then step 2 immediately. Concurrently, these steps were taking place, and so the vaccine was created much more rapidly with the same rigor and safety as all other prior vaccines. From a historical perspective, African Americans have a concern because of the history of systemic, institutional, and structural racism in America. And this is important because trust is big in healthcare, and there has not always been trust from the healthcare perspective in the African American community. The Tuskegee study, we know about that. We've heard a lot about that, and people are talking about that a lot with respect to concerns about safety with this vaccine.
All right, so with all of those things that you just talked about, the history component of it, the systemic racism component of it, if there are people who are listening, and also the time frame of it, if there are people who are listening and you're hitting on the points that they really want to hear that could possibly get them to that point to get that vaccine, but they still kind of don't trust the vaccine, what do you recommend that they do? Who do you recommend that they talk to?
Talk to someone they trust. Talk to their pastor. Talk to their doctor in particular. If you trust your doctor, talk to people who have already taken the vaccine and talk to them and ask them why they took the vaccine and how they feel about that vaccine right now. All of those things are important in convincing people and allowing them to begin to gain trust in the science that was done in creating this vaccine in a safe fashion.
All right, so I'm assuming that you got your vaccine.
Absolutely. Okay,
and so what was that like for you, and was there any kind of hesitation?
I will tell you that months ago I had some hesitation. Months ago when many other people had curiosity and concerns about this vaccine. But once I began to read more about the vaccine and understand the science behind it, I had no problems with getting the vaccine. I wanted the vaccine as soon as I could get it, and I've received 2 doses of vaccine already. I will tell you that after receiving the 2nd dose of the vaccine, my COVID anxiety that we all experience has dropped significantly. And so I feel safer I'm not 100% safe, but I feel a whole lot safer because I've received the vaccine. And I'll just share on a personal note that I have 3 adult children. My wife and I have 3 adult children who are all healthcare workers who've also received the vaccine. And they went and received the vaccine as well. So I got the vaccine because I want to keep my family safe, my friends safe, my colleagues safe. I want the pandemic to end, and I want to model this for other people as well.
Yes. So how would someone get an appointment? Because that's been kind of like an issue, especially the last week and a half. Are there plans to take the vaccine into local communities to make it more accessible?
From we know that too few African Americans are getting the COVID-19 vaccine. There's a disparity in the disease process with a higher incidence of COVID-19 affecting African Americans, making them sick, and actually they're dying as a result of this. And not enough African Americans are getting the vaccine. And so, in fact, Cone Health is being aggressive and intentional about reaching out to communities of color, targeting churches and other community organizations, going out and deploying mobile vaccine clinics in these communities to try to get the vaccine in arms to mitigate this disease process. Absolutely. A lot of work is involved with reaching out.
And I know that's a process. That's a process as we all learn what we need to do to get all of this done. So final thoughts regarding the vaccine, the African American community that you want to share.
Well, what I want to share is that I believe the vaccine is safe. I know it's effective. And I think that for us to reduce the incidence of death and illness in the African American community from COVID-19, we need to roll up our sleeves and we need to get the vaccine. It works so much better when more people get the vaccine. And there are a lot of people who need to get shots in arms, and we need to roll up our sleeves and go ahead and reach out and grab somebody else and encourage someone else to get the vaccine. Because that's the only way we're going to impact the death and destruction that's happening in the African American community right now.
Reach out, grab somebody, and take them with you to get the vaccine. All right,
Absolutely.
Dr. Powell is going to be with us until 6 o'clock, and he's going to be answering your coronavirus-related questions. So you can text those questions to us at 336-379-5775. Again, this is text only. Do not call. We will be back with your questions next.